Hopefully you'll be able to pharmacists. They work in a lot of settings outside of the community pharmacy setting, which is what people tend to picture when you hear the word pharmacist. So we'll cover those. We'll establish pharmacist as a key player in health disparities. So discussing different ways that pharmacists can help with health disparities and addressing things like social determinants of health. Showcase some pharmacist-led health disparities interventions, some from my personal experiences, as well as some outside of it. And then also just promote interprofessional collaboration and discuss how you can interact with pharmacists to help address health disparities. So if you want to participate in some different polling questions, you can scan this QR code with your phone or go to slido.com and enter the number there. And that will allow you to participate in just a few polling questions to engage in the presentation. And I'll let this stay up for just maybe 30 seconds to a minute. So if anyone wants to participate, they can scan now. Alrighty, I will move on, and you also will be able to access this on the individual questions if you missed it. All right, so first we'll just address who pharmacists are. So pharmacists are educated and specialize in everything medicine, from preparing, dispensing, proper storage, being able to educate patients on it. So anything medication is what pharmacists special in. They're really accessible within the community. So usually they see patients at least once a month. So they have that good touch point with patients and are accessible healthcare options to patients. As far as education, so they have to receive a doctor of pharmacy, which usually takes anywhere from 6 to 8 years, depending on the program. And then they also have an option to do 1 or 2 years of residency, as well as 1 or 2 years of a fellowship, which is what I'm currently doing. And then just general roles and responsibilities. So medication management, patient education, taking that time to let patients know about different aspects of disease states, and just general medication counseling. Interprofessional collaboration, so working with other healthcare providers to optimize patient outcomes, both on medicine and treatment plans. Other specialized services, so things like immunizations, and then also just community advocacy, getting into the health disparities and health equity space. So next, I'm going to kind of cover all the lesser known type of pharmacists, and then I'll cover what you normally picture when you hear the word pharmacist. So we have clinical pharmacists. They typically work in like a hospital or different clinics. They offer direct patient care and are integrated into the healthcare team, usually consisting of doctors, nurses, and other specialized providers. And basically their goal in this setting is to optimize medication therapy for patients in that integrated team setting. So helping make the best drug recommendations for those patients to optimize their care. There's also consultant pharmacists. They tend to work in a settings like long-term care facilities. Typically, they'll do medication therapy management, just reviewing all patients' medications, making sure they're appropriate, they're taking them right, see if there's any gaps in their therapies that need to be filled. They can also de-prescribe if the patient might be on inappropriate medications or medications that are no longer needed. And then just generally tailoring treatments to optimize patient health outcomes. Industry pharmacists tend to work in kind of more corporate settings, more corporate office settings. They do tons of different roles. They help with drug development. They really lean into their scientific expertise on different drugs to be able to kind of showcase new medications that are up and coming on the market. They also work as MSL, educating healthcare professionals about new products. And then they also focus on safety and efficacy standards once drugs are even in the market and already through the pipeline. And then lastly, we have nuclear pharmacists. So they can work in pharmacies, hospitals, and they're just really specialized in handling hazardous drugs. So they typically prepare radioactive drugs. So next, for the rest of this presentation, I'm really going to focus in on community pharmacists. So they do more than just dispense medications. So I'm kind of just going to go through different roles and things that pharmacists, community pharmacists do in their everyday. So chronic disease management, being able to educate patients on different aspects, medication therapy management, which I covered before, just being able to really review a patient's profile, see if they have duplicate therapies, maybe if they have any untreated disease states. Also health screenings and preventative care. I have patients come into the pharmacy a lot saying, hey, can you check my blood pressure? You know, they can't afford or don't have a blood pressure cuff at home. So doing things like that. Vaccination services. This has gotten really big during COVID and post-COVID. I know during flu season, I could spend entire shifts in the community pharmacy just giving out flu vaccines like back to back. So that's a really big area now. Bridging healthcare gaps. So all the time we have patients come into the pharmacy, and because they don't have to kind of book an appointment and go through paying potentially a copayment, pharmacists a lot of the time are the first place a patient comes when they have a general question. I have patients a lot, they would come in and say, you know, hey, I have this rash on my arm, and show me, you know, is there anything I can take over the counter for this? Or kind of, is it more serious and I might need to go to the doctor? So just kind of being able to fill those gaps, especially patients that may not have insurance or the funds to go to the doctor, being able to be that first touch point to see, you know, can we do something over the counter that might save you some money, or is it something a little more serious and you need to go see your primary care provider? Addressing social determinants of health. So because we see patients so often, we kind of get to build a deeper connection with them, and they'll share a lot of aspects of their life that I think normally I wouldn't get to discuss with them in other settings. So, for example, I have been working on a research project at a pharmacy in the Bronx, and what we're trying to do is integrate social determinants of health screenings into the pharmacy system. So patient comes in, we kind of do the social determinants of health screening, determine what the patient's needs are, and the goal is to link them to services and just make different recommendations that could help them. One example of this, when I was actually working at a community pharmacy in Florida, I had a patient come in and they were interested in smoking cessation. They were smoking cigarettes and kind of just were at a point where they really wanted to quit, but they didn't know about the cost of the nicotine replacement therapy and if that's a cost burden they could really take on. But I actually knew that the local AHEC program ran a kind of group therapy session in the area. And if you attended that, you would get group counseling for free, and they would also actually pay for your nicotine replacement therapy. So I was able to link that patient to that service to help them. And then it also saved them money. So just different things like that, from getting to know your patients and know different things going on in the community. And then also emergency prescriptions and harm reduction, things like naloxone accessibility in the pharmacy, Plan B, just different emergency medications that patients might need. So this will be the first question for participation. So what factors do you think contribute to health disparities? So that should be activated on your screen now, and we will see what comes in. And I'll pause here for maybe 30 seconds to a minute to see what everyone has to say. So it looks like we're getting a decent amount of answers in. Alrighty, so I will pause it now. So some things we shared, we have education and literacy. I see economic status and income coming up, access to care, reading levels, even the location where the patient is, We got systemic racism. The neighborhoods where they live ties into location. So those are all really good answers. All right, so the point of that question is to kind of just think about different aspects that impact our patients. And now I kind of want to discuss how community pharmacists can help address these different aspects to promote health equity. So community pharmacists can address health disparities through accessibility, trust and relationships, culturally competent care, medication access and affordability, providing preventative and chronic disease care, health education and literacy, and also through interprofessional collaboration. So I'm going to talk a little bit about each of these aspects. So we did have someone answer in the poll accessibility. So because community pharmacists are located pretty much in every community and really integrated into their neighborhoods, they just provide that accessibility factor. A lot of them have extended hours and are open longer than a typical maybe like physician's office. You don't need an appointment to go in to talk to a pharmacist, and some pharmacies are even 24 hours. So they really have that accessibility point, especially when you consider patients coming in, monthly. Some of them come in multiple times a month, and you get to interact and talk with them. Trust and relationship. So because you get to see them so often, you get to build that relationship. And pharmacists have continually been among the top trusted professions. So yeah, just being able to build that relationship, show you're there and care about the patient's needs, really can build that level of trust that makes patients want to open up to you and seek different help through you. So pharmacists can also provide culturally competent care because they're integrated into the community. They typically understand the needs of that community a little bit more than someone that might be, outside. They also do things like provide language services. There's tons of pharmacies that I've been in that offer translation services. They'll offer, medication pamphlets or prescription labels in different languages to accommodate patients. And then they can really just tailor the care to the specific needs of their community. So accessibility and affordability, being able to help patients navigate their insurance and also find lower cost alternatives is really valuable for patients. There's also assistance programs. So in my everyday work in community pharmacies, a lot of times I would have patients come in, they might not have insurance or their insurance doesn't cover a medication, but it doesn't take me that long to stop and look at things like GoodRx or seeing if maybe there's a discount card through the maker of the medication to apply on top of that to try and make medications more affordable for patients. Sometimes these things aren't available, but you're able to contact the prescriber and discuss lower cost options. For example, there might be a drug in the same drug class that their insurance does cover. So then just being able to make that switch and make sure the patient can afford their medication, because if they can't afford it, they're not going to take the medication, and then that treatment plan is going to be ineffective essentially. So preventative and chronic disease state care, so things like screenings that I discussed before, immunizations have gotten really big, and then just disease management, because we're so accessible. Again, any of these patients that might not have insurance or might not be able to afford to go see a physician can really get that first touch point with us to see if what we can do in the pharmacy for them or refer them to external resources. And then health education and literacy. So just being able to bridge gaps for patients all the time. I would have patients come in and they would say, for example, my doctor says I have hypertension. Like, what does that actually mean? Like, I don't know what this means. What does it mean? And then what can I do for this? Just being able to take time and stop and discuss with the patient, different things they might not understand, and bridging that gap so they can make the best decisions for themselves, the best informed decisions for themselves. And then just interprofessional collaboration. So being able to work with other healthcare providers from social workers, physicians, nurses, PAs, just to coordinate care and an overall goal to improve patient outcomes. So next, I'm going to discuss some pharmacist-led health disparities interventions. So this is the Community Pharmacist Ambassador Program. It is run through NovaScripts and the National Minority Quality Forum. So the roles of community pharmacist ambassadors are kind of to serve as health educators inside the pharmacy, but mostly outside the pharmacy to kind of disseminate health information to the community and to promote health equity. So they have a couple different ways they do this. So they can do one-on-one interactions with patients to help them with whatever it is they need, but they also have the Faith Health Alliance. So what this does is kind of pairs a pharmacist with a local church, and then they go to the church and just offer different services. Maybe they offer immunizations. They might discuss different disease states. Maybe a lot of members of that church have type 2 diabetes, so they can do kind of an intervention there, just discussing things like lifestyle management, different medications, and the importance of medications. And then there's also the Hair Wellness Warriors. So this one is the same concept, except it's pairing a pharmacist with a barbershop. So they can go there and do different teachings, but also just being a touch point if anyone there needs anything, or even just leaving educational flyers about different things that might be going on in the community. So they have a lot of healthcare focus areas, but some of them I just want to highlight. So immunizations, lupus, colorectal and lung cancer screenings are a big one for them, type 2 diabetes, and also just discussing clinical research trials. This is something big I've noticed in the community pharmacy setting. You never want to like push patients into participating in research, but you also want to make them informed and give them all the information appropriate so they can make decisions for them and their healthcare. Okay, so our next question is, in the past 3 months, how many flu vaccines have you administered? And then here is the QR code if anyone needs to scan that still. More seconds. Alrighty, so we got mostly zeros and someone said less than 20. All right, so next I kind of want to talk about COVID-19, flu, and just general immunizations. So I kind of want to discuss pharmacists as key healthcare access points during COVID-19. Because they did really step up and play a big role in vaccine distribution, administration, and even testing. So between February of 2020 and September of 2022, pharmacists provided over 42 million COVID-19 tests and also over 270 million vaccines. They also played a key role in combating misinformation and vaccine hesitancy. During this time, when I was in the pharmacy, there were so much misinformation and patients coming in, I've heard this or that about the vaccine, just a lot of general mistrust. So not to pressure them into it, but giving them, this kind of like the clinical side of things, letting them know the facts about the vaccine and then letting them make their own informed decision. This also expanded access to COVID-19 testing and treatment. So not having to make an appointment and being able to walk into the pharmacy and get the vaccine really kind of alleviated this large wait that we faced initially with patients trying to get the vaccine, and then just bridging the gap in that healthcare access as a result of that. And then also I just want to talk a little bit about the flu. So I know we're tapering off of flu season, but pharmacists also are administering a lot of flu vaccines now. So for the 2024 to 2025 flu season, there were over 36 million doses of the flu vaccine administered in retail pharmacies. I think the most recent literature estimated that about 36% of flu vaccines are given at pharmacies. So this is just a way that pharmacists can really alleviate burden on other providers and physicians. So, kind of allowing pharmacists to do this through the pharmacy makes it more accessible to the patient, but also gives provider time to spend on other specialized services that they can offer to patients. Next, I want to discuss community health workers. So they're kind of like public health workers that are in the front lines of communities, really just integrated into their communities. So they kind of act as a bridge between healthcare providers and community members. So these aren't necessarily pharmacists, but there are a couple of pharmacies in the United States now that have cross-trained pharmacy technicians and also pharmacists to be community health workers. So they can continue to do their normal pharmacy work. So they're preparing medications, collecting medical history, working on billing and counseling services. But they also can work to improve social determinants of health and health inequities through adding other services. For example, maybe you interact with a patient and you find out they are having transportation issues. Maybe they have a disability that's keeping them from being able to get into the pharmacy. Maybe their car broke down. You can recommend delivery services to the patient. They also are screening for social determinants of health. So I mentioned my project at the pharmacy in the Bronx right now. We're kind of doing that, and our big end goal with that is to try and make a dashboard to integrate into the electronic health record of the patient. So that way, this can be more automated and more at the forefront of the pharmacy and keep track of patients over time. And then with that data, being able to connect patients to community resources. So maybe I have a patient that is facing food insecurity, then I can link them to a local food bank that I might know about. And just if different instances like that. So something else that is really common that pharmacists and pharmacy students do are brown bag events. It basically just encourages patients and members of the community to bring in all of their medications, anything over the counter or prescribed, in a brown bag to be reviewed by a pharmacist for free. So these can happen at pharmacies, community centers. I've done them at health fairs a lot. So it really just gives patients that need a little extra help, or maybe they have difficulty managing their medications, a chance to talk to a pharmacist, ask any questions. So essentially what we do is we'll go through all their medications one by one. We usually provide a physical form where we list everything out so the patient can also take that away with them. We make sure they are on appropriate medications and there's no gaps in therapy. Through talking with the patient, we'll really try and make sure that they're taking the medications in an appropriate manner. So maybe if the medication is supposed to be taken at night and they tell me they're taking it in the morning, that's a great opportunity for me to counsel them and let them know how to appropriately take that medication. Being able to identify and avoid medication errors or drug interactions. So seeing if there's any medications that the patient shouldn't be on at the same time. And then also just assisting them in taking medications correctly. The brown bag events, they're really rewarding. All my time there isn't necessarily spent on medications. The last one I actually did, I remember we had a patient and she did not speak English, and she came and she was just in tears. And she was able to do like a tiny bit of English, and we kind of got to the point that she was able to explain that her tooth really hurt and she basically didn't know how to navigate our healthcare system to get help. But then she had that extra barrier because she didn't speak English. She also had to wait for interpretive services. While I wasn't directly able to help with her tooth, she cried and was able to get some emotions off her chest, and we were able to talk through it, which was good for her. But then we were also able to recommend something over the counter to kind of help alleviate her pain just a little bit while she tried to get that worked out. And I think she just left feeling good that someone at least took the time to stop and listen and hear her. And even though I couldn't fix her overarching problem, I could help with something kind of as a stepping stone along the way. So these are really great to get to know different communities and be able to help patients that might not know where to turn for help. So next, I wanted to talk about Hurricane Katrina and kind of key contributions of pharmacists during this time. So they were able to offer emergency medication dispensing. So a lot of medications were brought from outside of the local area, and then they were able to manage those and provide them under emergency for patients. They were also able to provide chronic disease management. So being able to help patients that have lost their medications, they're coming to you and letting you know, I have diabetes or hypertension, and being able to get them back on track for their disease state management. They offered a lot of public health support, just in general, linking patients to services, helping maintain shelters, really just anything that patients needed help with because they were on the front lines. They were able to either help them or point them to someone that could. They also offered clinical interventions. A big thing back then was that, you know, you had all of these places destroyed and not a lot of places were utilizing electronic health records. So now you had these patients without medications, but you also did not have any like paper trail, any record of what medications these patients could be on. But through kind of listening to patients, maybe you have a patient say, you know, I took a blue pill and I know it was for my heart. You know, you were able to kind of reconstruct their medication history as best as possible and be able to get these patients back on treatment. And then also just pharmacy operations in crisis. There was no physical pharmacies. A lot of them were kind of just makeshift shelves that were put up in the middle of different like fields or in a tent. So really just trying to have to navigate that without a filing system, an appropriate way of doing things. So some challenges that were really faced during this time. So there were huge drug shortages. They had to rely on um, kind of pharmaceutical products to be brought from outside these communities in for access. But then they also had to manage who needs what medication. There was a limited supply of everything. So they had to be really conscious about what patients were getting what medications and making sure the people who needed it most got them. There was the security risk. There was no, you know, lock and key like they have kind of controlled medications in the community pharmacy setting. So now they have to really guard the medications and make sure that they're being accessed properly to go to the people who need them. Lack of infrastructure. There was no nice shelves that were alphabetized with all the medications on them and a way of kind of filing those. So that was a problem. And then also, like I discussed, the loss of medical records. So kind of some things we learned and impact. So this really highlighted pharmacists as being essential healthcare providers, both in under normal circumstances, but also being able to assist in that emergency setting. Emphasize the need for disaster preparedness training. No one, you know, this wasn't something we necessarily predicted, but being able to be ready for these type of disasters moving forward and kind of maybe developing those systems. It really emphasize that. And also just showcase the ability of pharmacists to adapt, collaborate, and provide critical care in a time of crisis. All right, so our next question. So how do you think you can work with a pharmacist to promote health equity? I'm going to give a couple of minutes for this one because it might be a little bit longer of an answer. All right, just another minute or two for anyone else to share their thoughts. I will share some of them before we move on. So we have communication. That's what I want to know. So we'll talk about that a little bit. Share and provide available resources. Incorporate public health resources. That's a good one. Join education sessions like the one today. Yeah, that's helpful. Asking questions about misinformation you may hear in the community and online. Bilateral referral, providing information on cultural norms as it relates to medication adherence. This is a really big one. Outreach and screening programs, and support improved reimbursement for medication and pharmacy services. This one is really big and something that a lot of pharmacies are trying to work on. Pharmacists really want to do a lot of this work, like social determinants of health screening and kind of the public health aspect of things, but they aren't able to bill insurances for it. So that makes it really hard and for it to be sustainable in a pharmacy setting. Yeah, so just being able to bill for it. Okay, so yeah, all those are really good things. Something else, if you're a physician or you're a physician interested in collaborating, the laws are differing by state. For example, here in New York, pharmacists can enter in collaborative drug management agreements with physicians and be able to manage disease states like diabetes, hypertension. This kind of allows the pharmacist to do extra clinical services that they can provide to patients, um, and just be able to take on a bigger role. So yeah, that's a really big thing. You can look at whatever state you're in and see what the laws are and consider entering one. These are my references. And then any questions? I know I had one question in the chat. Someone wanted to know if these slides would be available. I'm happy to share them. If anyone wants me to email them, I can do that. And then for discussion, I will also leave these answers up. So if anyone has any questions or any other thoughts on how you think you can work with a pharmacist to promote health equity, I'd be happy to hear from you.
Thanks so much, Dr. Goins. That was excellent. Questions for Dr. Goins? I have two of my own, but I'll wait to see if anyone has pressing ones. Thanks again, Dr. Goins. So while people gather their thoughts, I had two questions. One has to do, so here in Delaware, we have really been working with the Board of Pharmacy and other partners to expand the role of pharmacists so that now pharmacists can give vaccinations, now they can prescribe contraceptives, and we're working on HIV pre and post-exposure prophylaxis. So we're kind of moving in that direction. But my first question. So I have like a number, this is anecdotal, but I have a number of friends, personal friends who are pharmacists. And I heard a lot from them and other sources, especially during COVID and even right after COVID, that the rate of burnout amongst pharmacists, community pharmacists in particular, was at an all-time high. And so the question is, if already they are burned out, overworked, overstretched, then from a practical standpoint, like adding on all these other things, making them look at the social determinants of health, do we think that would really be sustainable? So that's question one. And then question two is, you shared a lot of wonderful initiatives that you're doing at your university and the local area, like the Faith Health Alliance and community health worker pharmacists. My question is, because, for example, we have community health worker training, and Marco can speak about this. So it would be wonderful if we could kind of connect that with the community pharmacists. But the question is, who pays for all of this, right? Because most community pharmacists are Walgreens, Rite Aid, Walmart, and they are for profit. They're not in this to be charitable or philanthropic. So who pays for these kinds of programs like the Faith Health Alliance, the CHW Pharmacist Program?
Yeah, of course. So for your first question regarding burnout, I think that laws might have to change a little bit for these to be sustainable, but I do think that these are absolutely sustainable initiatives. For example, I know right now in New York, they allow one pharmacist to supervise two technicians. So being able to expand that and let them supervise more individuals would really allow for pharmacy services to kind of flow better and potentially relieve some of that burnout you described. And then also just thinking about kind of corporate pharmacy settings. So they'll sometimes place other requirements, such as signing up, 30 patients a day for a credit card or giving 5 flu vaccines, things like that. So I definitely think in more independent pharmacies in the community setting that this work could easily be integrated into the pharmacy and be sustainable. I think for more corporate pharmacies, they might have to change a little bit of the way they do things for that to be sustainable in their setting. And then as far as the community health workers, I think there's 3 pharmacies right now in the United States that have community health workers cross-trained as pharmacies and pharmacy techs. I know one of them, I think 2 of them were trained through grant services, and then one of them directly paid for their techs and pharmacists to be trained as community health workers. So potentially looking into more grant options to make this more affordable and easily integrated into more pharmacies would be helpful.
Thank you. Dr. Yuni.
Yeah, I just wanted to add to that point that Dr. Goins was making, especially on the sustainability of these models. So, I mean, I don't know whether if you remember back in 2020 when the COVID vaccines were developed, initially it was only available through hospitals. And I don't know whether, like patients had to wake up at 3 o'clock in the morning, get into a website, try to find a place. Right now, like the way we all are trying to get a real ID through the DMV, trying to see how far you have to go to get the real ID. It used to be like that for the COVID vaccines until they made it available through community pharmacies. And that was a game changer for COVID. Suddenly it was available and everybody was getting their COVID shots done. Did it add burden to pharmacists? Yes, but they have also taken the oath of a pharmacist. They know they have to do it and they're doing it. And I think the burnout after COVID, every profession is feeling it. Everybody saw life in a different way. And everybody understood that should I do this wheel or not? So I think there's a change in that. But what we feel is that the more we allow pharmacists to do more of those kind of like the way you all are promoting for prescriptions and all those kind of things, it's great. So when more and more pharmacists are doing it and that gets reimbursed, there will be more pharmacists working in a pharmacy and making it more sustainable. So it is like a egg or chicken question, right? Should the pharmacists do this or should we get reimbursed? And I think pharmacists have been doing this forever without getting reimbursed. And it has come to a point where they're saying, we need money to do these things, right? So I think that's where the difference is coming. So having the physicians and other healthcare providers having a back and showing that what we can do will help us to promote the accessibility part the pharmacists have. As Jenna was saying, we are available in every community. We belong to the community and people look at us like that. So just adding the point that we need the physician support to help us be a support to the community and reduce the health disparities.
Awesome. Thank you. Other questions or comments? Dr. McCoy, do you have a comment or question?
I do. I have a comment. I have a question. I want to say thank you, Dr. Goins, for your presentation. Very informative. Wrote down a couple points that I would love to partner with or get some additional information how you started up some of those community programs. But I do want to add on, Dr. Maduka actually hit it right on the head. I actually transitioned out of community pharmacy after spending 15 years at retail and then finally having enough, had it graduating during COVID and transferring into public health. So I'm seeing both sides of it. And I'm just really first starting in pharmacy to advocate for our community, and especially being of Caribbean descent and all that hesitancy and medical adherence. I felt there was a need that I needed to be a part of it. But then now advocating for the professional pharmacy, and to add on to the point of burnout, when you talk about we are easily accessible, we're one of the most accessible healthcare professionals in the community. Just knowing that a lot of our community partners, hours are now being cut. I think there's only one 24-hour pharmacy now in Delaware, where there used to be two. But now meeting metrics, so I feel like a lot of my colleagues, they're not able to do all that we want to do and actually counsel our patients properly on their diabetes medication or how to take over-the-counter supplements. Because we're required to hit a certain metric, and it's now turned into hitting metrics and numbers, whereas not having enough time to counsel. Do you find that, or how do you overcome that barrier? Being that I just visited the pharmacy yesterday, and although the pharmacist was flagged to come talk to me about a new prescription, they just had the technician ask me if I need to talk to them, and pretty much you get dismissed. There's not a lot of time to talk to your community pharmacist. Do you find that as an issue as well?
I think it depends on the type of pharmacy again. So the big name pharmacies that I have spent time in, I have noticed that being an issue because the pharmacists there are more worried about meeting the metrics and the expectations that have been set for them for things like credit cards or like giving a certain amount of vaccines. In my independent pharmacy experiences, I don't really agree with that. I think the pharmacists there have had a lot more time to stop and get to know their patients and just help them with anything. And they value the relationships that they're really building within their community and kind of pride themselves in taking that time to stop and help patients. Yeah, there's days in the community pharmacy, independent pharmacy that's busy, but that, we don't have all these metrics to meet. So I think it's easier for them to stop and, like you said, go over the counter and talk about over-the-counter supplements. The pharmacy that I've been at the Bronx, this has not been a problem with at all. The pharmacists there are happy to go and stop and talk to a patient or take their blood pressure, anything like that. So I think it just depends on the type of pharmacy, independent versus a big corporate one.
Yeah, and that might be a nuance, a difference between New York versus Delaware, right?
Yeah.
Because in Delaware, like I'm just thinking within 3 miles of my house, I have 4 pharmacies, Walmart, Walgreens, Rite Aid, and another Walgreens. There is no independent pharmacy. So it depends on where you are in the country, whereas I'm told that in New York, you don't have Walmart, New York City, for example. So it's kind of figuring out with whatever the community pharmacy we have where we are, how we can work with that. And maybe the reimbursement might help. I don't know.
I totally agree. Again, independent pharmacies work in a very different way, and New York has a lot of independent pharmacies compared to some other places. But I also have to say that pharmacies are understanding, the corporates are understanding that they need to work on this more. So for example, right now, not right now, like it started 2 years back. Walgreens started an initiative where they have taken the School of Pharmacy's deans and they have formed so the first year when they started, they got all the, we have 150 pharmacy schools across the country. So they took all Humor deans went in to understand what does the coming pharmacists want? What do they want? And because the generation also changed, right? So the current generation don't work like the way the older generation did. If they don't like it, they walk out. So
Right.
they wanted to make sure. So Walgreens worked with all the deans, and now they have a council of deans, and I think that is around 40 deans who's working with Walgreens very closely to understand or make them understand the working conditions, what does a pharmacist need, how does to make it sustainable. So I can see the corporates also changing. Again, one of the big differences in the US compared to a lot of other countries is that in other developed countries in the West, pharmacies are only owned by pharmacists. And that means it's like independent pharmacy. There's a lot of pride in that. But the corporates are owned by anyone, right? So you never know. But but they're changing, they're trying, but it is going to be a long change. And I think that's where pharmacists need more of the support from every other healthcare provider to push for the reimbursement, say that you're an essential part of this. We need you to get this health disparities reduced, be accessible to the community. And the more we stand together, I think that issue will go away slowly, and it will actually become what it is supposed to be.
Yeah, I agree. And we're limited as pharmacy schools in Delaware. So we don't have a particular pharmacy school that we can associate with. But I know being in Massachusetts when I got my pharmacy degree, we did a lot of partnership. We did the brown paper bag, and I've come to find out, or we actually developed a new curriculum with over-the-counter medication because we've noticed that a lot of our community is now relying on herbal medication, whereas our older pharmacists are not trained in the over-the-counter, the rice, the red rice yeast, and that a lot of interaction. So just knowing that a lot of our community, especially as they get older, they rely. I'm Caribbean. They think tea heals all. So you're still important. You can drink your tea, but you still need to take your blood pressure medication. Just understanding the community need and where you are. But I want to be a part of, because I'm limited to antimicrobial stewardship. I still think that we could use our surrounding pharmacy schools to maybe come in and do internships in our community pharmacies, do the brown paper bags, medication reviews. And I think that's good practice to not only know the medications and drug interactions with prescribed medications and over the counter, but just getting involved and being comfortable with talking to the community and knowing the levels of how you need to talk to people and your audience. So I think that would benefit a lot, Dr. Maduka. I would love if we could get together and figure out how we can use Jefferson's pharmacy majors and just bring them to Delaware because we're so close, and try to work on maybe doing some community outreach. I've never heard of, one of the things you mentioned was I think it was you do an outreach, like advocating, where you come out into the pharmacies and the pharmacist comes out and talks to the community. I think that's amazing. And just, I come from public health, so just knowing that linking public health resources when you screen patients about nicotine sensation and diabetes and Narcan, I think just having those public health information or brochures in our pharmacies at CVS, at Walgreens, just knowing that the state of Delaware does offer these services would be amazing to have. So again, something I might turn to you, Dr. Maduka. And although I'm stewardship,
Yes, absolutely.
my background is still pharmacy, so I still like to be a part in community. So, but
Yes,
thank you for that
let's definitely
presentation.
connect.
Yeah,
I mean, Dr. McCoy, I'm sure Jenna, if you can send her the ambassadorship program so that, she can be an ambassador.
I
And
would love, I think I do it already, but I would love to have an official title, being an ambassador.
And the one thing I would ask of all the physicians who are out listening to this is that one of the best things you can do is, if you know your patient is having so many medicines to take and they might be going to the pharmacy 4 times a month, which can actually lead to disparity. They may not have the time, they may be missing medicines. So just tell them to ask the pharmacist to the med reconciliation so they can go through all the medicines and work with the insurance companies in a way that everything can be picked up at the same day every month or every 3 months. You know, that will reduce their visits to the pharmacy and they become more adherent. So that's one of the easiest things any physician can recommend to the patient, especially if they have multiple medicines they are taking to do the med reconciliation. Just tell your pharmacist to do med reconciliation, and any pharmacist will do that for your patients.
Awesome, thank you. All right, anyone else? Questions, comments, concerns? Going once, going twice? Dr. Goins, let's give you the last word. Like, if there's one take-home message for this group, what would that be from you?
Really just focusing on the interprofessional collaboration aspect and engaging with community pharmacists and developing ways that you can collaborate to help make the best outcomes for your patients.
Awesome. Very good. Thank you so much, Dr. Goins. That was excellent.
No problem. Thank you so much for having me. And I'm happy if anyone needs to email me or has any further questions, I'm happy to answer those.
Awesome. Thanks everyone for joining.